Welcome back, dear viewers. If you're just tuning in, you're watching Hala Kuwait on KTV2, the family channel, of course. And I'm pleased to be joined by our distinguished guest in the studio, Dr. Fatimah Alansari, who is a cardiovascular rehabilitation specialist. Good evening, and thank you for joining us on Hala Kuwait.
Thank you, Imran. It's a pleasure to be here.
Now, doctor, what physical sign tells you that you push slightly beyond your safe zone or your limit during an exercise?
Well, the first physical sign when patients are exercising usually is the heart rate. They would feel like some sort of palpitations, or that the heart rate is increasing. And of course, when they feel like they're almost trying to gasp for air. You would also sometimes would have patients that would have muscle spasm or tight or like pain, some sort of muscle pain.
Like an ache.
Yes, exactly. Now, when we monitor the patients, we also monitor them very objectively to compare what the patient is feeling according to these signs that the patient is feeling while they're exercising. So we check the blood pressure, the heart rate, the SpO2, which is the oxygen saturation, and of course, definitely tell the patient to slow down, decrease the intensity of the exercise itself, decrease also probably reduce the time, the duration of the exercise training. So a combination of all these factors, a cardiac rehab specialist should be aware of, and definitely communicate with the patient just to make the patient feel well.
I see. So which daily activity increases the heart effort the fastest?
Well, usually any vigorous physical activity that you do. If you're, for instance, if you're just walking around, let's say the neighborhood, but if you're walking very fast, that's probably, and it's not in your daily routine, that would probably affect you also and will make you exhaust or fatigue easily. And also, let's say, for instance, climbing the stairs, that's very vigorous. And also, if you're going very fast, because just climbing stairs on its own, just by walking to climb up the stairs, it needs a lot of effort. So it raises your heart rate and your blood pressure. That also, let's say, for instance, like with younger patients who usually go to the gym and work out also, do jogging, jumping rope, whatever sort of, any vigorous physical activity that could, during the day would exhaust the patient.
So when does your heart recover the slowest, morning or evening?
Well, according to studies, usually morning time the heart recovers the slowest, because usually in the morning we are ready to go out, go to work. So recovering during that day, you are stressed.
Yes.
You're preparing to do other chores, probably looking after the kids, doing their homework. By the time you get back home, you are less stressful, and that's the time when you rest and unwind. So the heart recovers better during the evening. And that's why we usually we advise patients, even regular people, individuals, to exercise during the morning.
Yeah.
Of course, if you don't have time, you can find another time during the day, but usually it would be better, because if you do exercise in the evening, it will probably even affect your night sleep. And then also because the parasympathetic system, the central system, which is responsible for making us feel relaxed, you are kind of like reactivating it, the sympathetic, which is the opposite. So you're making yourself more, let's say, more alert and awake. So it will affect your evening.
Does that have anything to do with the circadian rhythm?
Yes, yes, definitely.
Yeah. So what symptom appears first when you're dehydrated during rehab, let's say?
Well, definitely, of course, you will feel thirst. You're thirsty. Patients will feel their mouth is dry. And that's why I always tell my patients to dehydrate. And that's not just when they're exercising. They need to dehydrate even before coming to the session. If they're coming to the session, some patients of mine come like later in the day. So I tell them to dehydrate even the day before if they know that they're coming to exercise. Now, patients who exercise on a daily routine, of course, definitely they need to dehydrate.
Yes.
And sorry, they need to have drink water all the time. And it's okay to drink water while you're exercising, because there's a myth that you're not supposed to drink water. It will probably affect or slow you down, affect your exercise training. But actually, that is all wrong information. So you are okay to drink, even if little sips of water, just to keep you hydrated. But definitely drink after exercising, because you're going to lose a lot. And even if you're not sweating, even if patients also think because the more you sweat, that means the more that you're doing better with your exercise training, and that has nothing to do with that. You will probably lose water. For instance, like, you know, when patients, when they're going to the bathroom or whatever. So that's another way of losing fluids from your body.
Yeah, doing normal, basically, bodily functions.
Definitely,
Yeah,
yes,
yeah.
exactly.
So which exercise makes you most aware of your breathing rhythm?
Well, usually those, they are considered mainly the breathing exercises, because again, you're more conscious, you're more aware of your breathing rhythm. So these exercises are the ones that you know that that involves breathing rhythm during exercising. Now, we sometimes tell patients to do some breathing exercises before, during the warm-up of the session, or during, or even after. And there's many kinds of breathing exercises, but those are the ones that you will feel that you're actually, you know, doing.
Well, Dr. Fatimah, this is very educational. I would like to pause there as we move on to report, and we'll be right back to the questions. Well, dear viewers, now we move on to this report that we have prepared. Let's watch it together. We'll be right back. Stay tuned. Welcome back, dear viewers, and I'm pleased once again to be joined by our distinguished guest in the studio, Dr. Fatimah Alansari, who is a cardiovascular rehabilitation specialist. Now, Dr. Fatimah, what do you notice in your heart within 2 minutes after stopping activity?
After 2 minutes of stopping any exercise training with the patients, usually the heart rate is still a little bit high, but normally it should go back down to their normal rate as when they first came during rest, within 2 to 3 minutes.
Yes.
So we advise patients, not sometimes, because there are patients that do panic, that they would look at the monitor, look at their heart rate, that it's still high, or their blood pressure, that it's still high. And those signs are very normal. But even when we do any special test for exercise tolerance and exercise capacity, usually we do give a recovery time between 2 to 3 minutes, just to make sure that everything, all these vital signs go back to normal. And then we make the patients sit and wait and recover and cool down and rest before we send them back to go home. So these are protocols. These protocols are a must. But definitely 2 minutes, you would still probably see a rise in the heart rate. But definitely it is going down a few further more minutes after.
Okay, so doctor, you touched on the exercise capacity. Can you elaborate on that for our dear viewers?
Sure. The exercise capacity now, it's sometimes some of my colleagues, they would use the word functional capacity, but I learned a long time early on when I was doing my master's degree and my PhD that there is a difference between exercise capacity and functional capacity. So exercise capacity is more measurable. It's through, we test through the 6-minute walk test. There are different walk tests. There's the 3-minute walk test, the 6-minute walk test, and the 12-minute walk test. And then we have also through the cardiopulmonary exercise testing, which I did with my PhD thesis. It's a very gold standard, sophisticated exercise capacity test for the patients. And also, there's also like the Chester step test from where I was graduated they were the founders of the Chester exercise test. So you look into any test that we have these tools. What is the most appropriate for your patient to use? They're very measurable, and you see how much the patient can walk or can run, or even using the cycle. And even these tests within them, especially the cardiopulmonary exercise testing, has its own protocols. There's so many different kind of protocols, whether increasing the speed or increasing the resistance or the inclination of the treadmill. So it's a very big topic of how to test the exercise capacity, but it's very interesting.
Indeed. So now, when we move on from that testing, let's shift gears to the medications. Which of your medications affect your exercise tolerance the most?
Well, actually, a lot of medications that patients, especially heart patients, take, usually most of them, they would affect. Let's say, for instance, the statins that control your cholesterol. They would give sometimes some muscle cramps during exercise, diuretics. This because it increases the urination of the patient. So sometimes they would be dehydrated. So again, back to drinking a lot of water to make up for the loss of the fluids. And then also you would have the beta blockers. The beta blockers, they control and reduce the heart rate and the blood pressure. And that actually does affect also the exercise training, because the heart is not pumping as fast as it would normally do. So what happens is they would feel fatigued easily because there's not a lot of oxygen pumping throughout their body.
So short breath.
Exactly. And I do have a lot of patients like that. So sometimes I would ask the patients not to take, especially beta blockers, before exercising. And of course I would talk to their cardiologist, but because it really affects their exercise training. And they will get fatigued easily. And I don't want patients to get fatigued and feel like they're turned off from their exercise session. I want them to come, feel confident, and have fun and do their exercises. And then right after the exercise session is done, they can immediately take their, And it also diabetic patients with diabetes, also they, some of the medications affect their exercise training.
Interesting.
Yeah.
So after a poor night's sleep, let's say, what exact heart symptoms appear during training?
Well, it definitely, well, if a patient hasn't slept well, usually it does affect their exercise training. So number one thing is they're fatigued. They will come, they're stressed, they're fatigued, and because they are fatigued, it will definitely show in their heart rate, their vital signs. It will probably make them drowsy. And the question also about the medication, sometimes if they've taken allergy pills, and allergy pills are usually taken at night. So some patients, they would take it because they haven't slept well, they would take an extra dose. That also will affect them if they haven't had a good night's sleep. So sleeping is a must. And I always advise the patients that you have to sleep in order to just perform well, do well during your exercise training,
and to sustain
for the program, because you will have better outcomes, you'll have better results. If the patients are not coming and they're not sleeping well and they're not eating well, it's a big waste of their time for them. So
they're basically impeding their own progress.
Definitely, yes, definitely.
So what food or meal makes your heart work harder afterwards?
Oh, that's easy. It's just fatty foods, large meals, a lot of sugary food.
Irresistible foods.
Exactly, because especially with sugary food, when they would come, they would think that, oh, I had like chocolate or whatever, but then, or let's say a latte, or any of those frothy coffees that people love to drink. But actually, they would, because they think it has coffee. It actually slows them down later and makes them feel, you know. So again, I do have patients that prefer to come after their lunch meals. And then when they come, they do feel, you know, tired and fatigued, and they don't exercise well. So I tell them, again, take way lesser amounts of food before you come and exercise. Even if they think they can do it, and they would tell me, oh, Doctora, I ate less, and they still, you know, or I would tell them to have a longer duration of resting time. But that is also another problem, because they would probably feel sleepy after a large meal, and then they would not come to their exercise session, and they would stay home. So definitely they have to cut down, or skip the lunch, have a very light snack, and then they can have their lunch afterwards, because it really affects exercise training.
And what is the earliest body signal that tells you to slow down?
Well, the first thing usually is feeling breathlessness. So, and especially if we have, like, I just had one of my patients last week thinking that I want to increase the intensity. So immediately she felt like she was out of breath. And again, you have to be, I always recommend that you have to keep your rate, maintain your rate. Do not change the numbers of the intensity, of the duration, of the frequency, because these patients are really fragile. So any kind of change, it will definitely show in their progress. In their performance, and then it will affect their progress. So definitely signs of fatigue, breathlessness, those signs, sometimes definitely they would have. The cramps usually come after 12, almost 24 hours. They would show the next day. But also I tell patients not to panic, because these cramps are very normal, and then it will take a day or two. And then as long as they keep moving, they keep exercising, it will be all normal, and everything will go. Everything will subside.
Well, doctor, we do appreciate you being with us and sharing your insights. Thank you for being on Hala Kuwait.
Thank you, Imran. It was a pleasure being here. Thank you for having me.
Thank you. Now, doctor, that was Dr. Fatimah Alansari, who is a cardiovascular rehabilitation specialist. Now, dear viewers, we move on to this report, so stay with us.